I want you to stop and think about the last time you took a pill. Did you take it with water? Did you consider what you ate for breakfast? Did you think about the herbal supplement you took last night? If your answer is no, you are like the majority of people, and I need your full attention. We live in a world where we take more medications, both prescription and over-the-counter, than ever before, often alongside a complex cocktail of supplements. The risk of something going wrong isn't just a tiny footnote. It's a major public health concern. I am talking about drug interactions, the silent, invisible threat that can turn a necessary treatment into a medical crisis. To understand why interactions are so dangerous, I need to introduce you to the core concept of pharmacokinetics. Simply put, this is what your body does to a drug. There are 4 main steps, often abbreviated as ADME: absorption, distribution, metabolism, and excretion. An interaction occurs when a second substance, another drug, a food, or a supplement, interferes with any of these 4 steps. For example, if one medication dramatically speeds up the metabolism of a second drug, that second drug might be broken down before it even has time to work, rendering your treatment ineffective. Conversely, if one substance blocks the metabolism of a drug, the original drug can build up to toxic levels in your body. It's a delicate, beautiful, and easily disrupted biological process. Let's look at the most common type, drug-drug interactions. These can be categorized into 2 main effects, synergistic and antagonistic. Synergistic means the combined effect is greater than the sum of their individual effects. Imagine taking 2 different sedatives. I'm talking about something as simple as combining an opioid painkiller with an antihistamine that causes drowsiness. Alone, they might be fine, but together, the combined sedation can dangerously slow your breathing. I have seen this lead to frightening outcomes. The other side is antagonistic, where the combined effect is less than what you expect. A classic example I always stress is mixing certain antibiotics with hormonal birth control. Some antibiotics can interfere with the gut bacteria needed to reabsorb the hormones, effectively lowering the birth control's effectiveness. Now, let me paint you a picture with a specific and unfortunately common example of a drug-food interaction. Meet Sarah, a 45-year-old busy professional who just started taking a common statin to lower her cholesterol and a calcium channel blocker for mild high blood pressure. Sarah is health conscious and loves starting her day with a refreshing glass of grapefruit juice. What Sarah doesn't know is that grapefruit juice contains compounds that inhibit a specific enzyme in her liver called CYP3A4, which is responsible for metabolizing both her statin and her blood pressure medication. By blocking this cleanup crew enzyme, Sarah is causing the drugs to build up in her system, mimicking an overdose. The result? She might experience severe muscle pain, a sign of statin toxicity, or dangerous drops in blood pressure and an increased risk of kidney damage. I want you to remember this case. Simple food choices can have pharmacological consequences. The final 2 areas are drug food beyond grapefruit and drug supplement interactions. Think about taking certain thyroid medications. I advise patients to avoid taking them with calcium or iron supplements because those minerals can severely block the absorption of the drug. Or consider the common blood thinner warfarin. Its effectiveness is dramatically affected by vitamin K intake, meaning even healthy, consistent consumption of green leafy vegetables needs to be monitored closely. Then there are herbal supplements. St. John's wort, often taken for mood support, is a powerful enzyme inducer. It accelerates the metabolism of countless prescription drugs, including HIV medications, oral contraceptives, and antidepressants. I see people take these without telling their doctor because they think it's natural, it can't hurt. But natural doesn't mean inert. So, what can I empower you to do right now? You must become your own best advocate. I have 3 non-negotiable questions you must ask your doctor or pharmacist every single time a new medication is prescribed. 1. What are the 3 most common drug-drug interactions I should watch out for? 2. Are there any specific foods, drinks, or over-the-counter products, including herbal teas, that I absolutely must avoid? 3. What is the number 1 warning sign of a serious side effect or interaction I need to call you about immediately? Make this a habit. Write it down. Your life and your health depend on this diligence. Understanding drug interactions is not about fear. It's about respect for the powerful chemistry happening inside your body. I implore you, always keep a master list of everything you consume, prescriptions, OTC drugs, vitamins, and supplements, and share it openly with every provider. Be safe, be vigilant, and be informed. If this video has shed some light on this complex topic for you, please show your support by hitting the like button. Subscribe for more deep dives into health and medical safety, and share this with anyone you know who takes multiple medications. I'll be back next time to tackle the confusing world of generic versus brand name drugs. So turn on those notifications. Take care and stay safe.